Okay, everybody, welcome to today's edition of the Health and Healthcare webinar series, brought to you by the Governor's Rural Affairs Council, Rural Partners, and University of Illinois Extension. My name is Mike Delaney, and I'm an Extension Community and Economic Development educator based up in Ogle County in the Northern State Line region. Delighted to welcome you all today, and I'm going to start with some quick housekeeping notes. These will all be familiar to you. Please note, as Nancy's already indicated in the chat, that we will be recording today's webinar. And after the conclusion of today's presentation, registered participants will receive an email with slides from the webinar and a link to the recording. If you didn't register in advance for the webinar, that's fine. If you'd like to receive the materials, please put your email in the chat box and let us know. Or, as I indicated earlier, use the registration link to actually submit a registration. Please note, again, as Nancy has noted, that if you desire, you can activate Zoom's closed captioning function at the bottom of your screen. And as always, you're welcome at any time to share your questions in the Zoom chat space. Let you know that we will review the questions in a Q&A period following the main presentation. Now, with thanks to Rural Partners, one of our co-sponsors here, I would like to note that today's topic covers the programming offered by the Department of Human Services Family Community Services function, which includes the Supplemental Nutrition Assistance Program, known as SNAP, Temporary Assistance to Needy Families, TANF, and Medicaid. In that regard, we are welcoming today Diane Campbell to our virtual lectern. Diane is a regional administrator with the Department of Human Services. She is responsible for 11 family community resources offices that cover 28 counties in West Central Illinois and manages 368 employees. Diane is in her 39th year with the Department of Human Services, and we are delighted to have her speaking today. Diane, the virtual lectern is yours.
Thank you, Mike. I'm very excited to be here and be able to talk with you all this afternoon. As Mike said, I am Diane Campbell, and I am a regional administrator with the Illinois Department of Human Services, Family Community Services. And so this afternoon, I will be presenting an overview of the DHS programs within Family and Community Services Division. And this presentation is designed to provide you with a brief overview of the benefit programs the Illinois Department of Human Services, Family Community Services offers to the public and how to apply for these benefits. As Mike referenced, DHS provides cash payments, food benefits, and medical coverage for individuals who are eligible. These programs are based on federal law, state law, and court rulings. The Supplemental Nutrition Assistance Program, or SNAP, was formerly the Food Stamp Program, and it is a federal nutrition program to help low-income individuals and families buy the food they need for good health. Households with low income can receive SNAP benefits depending upon the household's income, expenses, and the number of people that live and eat together. A household might be eligible to receive SNAP benefits if their monthly gross income does not exceed the gross income limits. And these income limits do vary each year. Currently, a one-person household's gross income limit is $2,005 per month, and a four-person household's gross income limit is $4,125 per month. The monthly SNAP benefit, the dollar amount, is based on the number of people in the household and the monthly income available to meet the needs after the caseworker subtracts the allowable deductions such as rent, utilities, childcare, and some medical expenses from the gross income. The maximum dollar amount of SNAP currently for one person is $291 per month. And for a four-person household, it is $973 per month. SNAP benefits can be used to purchase food or food products for human consumption. This does not include ready-to-eat hot foods. However, they can purchase seeds and plants for use in home gardens that do produce food. Those approved to receive either cash and/or SNAP assistance will be issued an Illinois Link card. This card is plastic and it looks just like a credit card or a debit card, and it works in the same way. Only one Link card is issued per account. There are two ways to manage Link accounts. The first way would be for customers to go to the Illinois Link Card website and register for an account. There are options for different languages on the login screen. The other option is to manage a Link account by calling the Illinois Link helpline, which is 1-800-678-LINK. The customer will need their 16 or 19-digit card number to access through the prompts. If they don't have their card number, they will be asked if they want to use their Social Security number, date of birth, or PIN. The services available on the Link website or the Link helpline include changing an address, check Link account balance, report a lost or stolen Link card, order a replacement Link card, select their first PIN or change a current PIN, check recent purchases and withdrawals, or report a problem with a purchase or withdrawal. The next program we're going to talk about is the Temporary Assistance for Needy Families, or TANF. The TANF program is run by DHS and is for families with children or pregnant women who need temporary cash assistance. Those eligible for TANF benefits are also eligible for medical assistance, and in most circumstances are also eligible for SNAP benefits. The TANF provides financial assistance to help pay for food, shelter, utilities, and expenses other than medical. There is a 60-month time limit to receive TANF cash, which includes months that a customer received TANF cash benefits in another state. For TANF cash, no payment is received for the first 30 days, including the date of application. Customers are eligible to receive cash benefits from day 31 forward. The qualifications for TANF include be pregnant or have a child under 19 who lives with the parent applying, live in Illinois, be a U.S. citizen, or meet certain immigration requirements, and they must develop a plan for becoming self-sufficient with their caseworker and follow it. The services offered for TANF include a 60-month lifetime cash assistance, transitional services to move families to self-sufficiency, such as GED preparation, vocational training, post-secondary education, vocational rehabilitation, classes in basic English, assistance with childcare, work stipends, and job retention services. There is also a screening completed to identify barriers to becoming self-sufficient related to substance abuse, mental health, and domestic violence. Customers will be referred to available services to address those barriers. Just an example of the dollar amount of TANF cash benefits would be a household of 2, which would be a parent and child, $575 per month, and a household of 4, which consists of either 2 parents and 2 children, or 1 parent and 3 children, is $875 per month. Now we're going to talk about the medical assistance programs. Illinois Healthcare and Family Services, HFS, which is our sister agency. Medical programs cover a wide variety of applicants based on certain criteria. Persons receiving medical assistance will receive a medical card after their case is approved. All eligible individuals are listed on the card with an identifying recipient number. The medical card has to be presented just like an insurance card to medical providers, doctors, hospitals, pharmacies, anywhere that they are getting medical service. Medical eligibility is retroactive to the first of the month of the application, and medical eligibility can be backdated up to 3 months prior to the month of application if the customer requests and if they are eligible. The Family Assist program is for families whose income is at or below the TANF cash payment level, which we talked about, which is really pretty low. If the family's income increases above the Family Assist level while they are receiving Family Assist, they may be eligible up to a year on a medical extension that does provide the same coverage. Family Care Assist is for a parent or caretaker relative and their spouse of children under the age of 18 with countable income greater than the Family Assist limit, but equal to or less 138% of the federal poverty level. All Kids Assist is for children under age 19, regardless of immigration status or health condition. The income limit for All Kids Assist is equal to or less than 318% of the federal poverty level. Children are guaranteed eligibility for 12 months of medical coverage. Moms and Babies is for pregnant women and infants under 12 months of age who are born to eligible women whose income is above the Family Assist limit, but equal to or less than 213% of the federal poverty level. Coverage includes inpatient and outpatient services during pregnancy and 12 months of postpartum coverage. Family Health Spend-Down medical benefits are for children with household income over All Kids Assist limit and for pregnant women with income over the Moms and Babies limit. The spend-down amount is the difference between the household unit's countable income and the Family Health Spend-Down standard. Medical bills must be incurred and they must be equal to or exceed the monthly spend-down amount before medical coverage can be provided. We often reference to our customers, this is similar to an insurance deductible. However, it's not yearly, it is monthly. Medicaid presumptive eligibility provides immediate temporary coverage for outpatient care for pregnant women. This coverage starts on the date of the MPE application until the moms and babies application is approved. The income limit for MPE is 213% of the federal poverty level. The Affordable Care Act Adult, or ACA, is for persons ages 19 to 64 who don't qualify for family health plan or former foster care and whose income is equal to or less than 138% of the federal poverty level. If a person is blind or disabled and does not have Medicare, they may qualify for the ACA program. The income guideline is 38% higher than the what we're going to talk about here in a couple minutes, aid to the aged, blind, and disabled. The Family Planning Program covers related services to prevent or plan pregnancy, provide preconception and fertility awareness, education, and provide medical, diagnostic, and treatment services. The income limit to qualify is 213% of the federal poverty level. The Aid to the Aged, Blind, and Disabled Medical Program, AABD, is for persons 65 or older, blind, or have a disability. Income limit, 100% of the federal poverty level, and there is also an asset limit. For those AABD customers whose income is above the 100% of the federal poverty level or their assets exceed the asset limit, a spend down case may be approved. And that works the same way as what we talked previously. It is a monthly amount similar to a deductible. We also have what we call the Medicare Savings Program, and that's for persons who are enrolled in Medicare Part A or Parts A and B. And that helps to pay Medicare premiums, co-insurance, and deductibles. And the amount of help will depend on the level of income and assets. To qualify for the Aid to the Aged, Blind, and Disabled program, a customer must receive supplemental security income or are ineligible for SSI due to income or expiration of federal time limit on assistance to certain immigrants who have not yet become U.S. citizens, are a U.S. citizen or meet certain requirements for non-citizens. They must live in Illinois, be 65 or older, blind or disabled. Eligibility, once again, is based on income and assets. There are several different ways to apply for assistance. Customers can go online at abe.illinois.gov. They can call our customer call center, 1-800-843-6154. They can apply in person at a Family Community Resource Center, or they can apply by paper application, which can be dropped off or mailed to one of our Family Community Resource Centers. The dhs.state.il.us website has a link to find all the locations of the Family Community Resource Centers throughout Illinois. Customers must report all income and assets they are asked about on the application and also provide documentation. To speed up the application process, customers should provide verification of income for the past 30 days. Types of income do include salaries, wages, tips, self-employment, rental income, Social Security benefits, unemployment, railroad benefits, private pensions, child support, alimony, and contributions. Assets would include checking and savings accounts, stocks, bonds, mutual funds, life insurance, property, vehicles, and burial funds. The ABE Manage My Case portal can be used by customers. All they have to do is create a user ID and password, and they will be able to check the status of their application, renew their benefits, report changes in income or household members, expenses, or change their address. They can upload documents such as wage stubs. They can view their notices. They can view and reschedule upcoming appointments. And they can also file and manage appeals. This slide actually will provide links to all of our program brochures for SNAP, medical, TANF, and AABD. There is also a link there to access the paper application and the ABE website to apply online. And in addition, SNAP eligibility calculator, so someone may be able to see if they are eligible by gross income. I know that was a lot of information, so I am happy to answer any questions at this time.
Terrific. Diane, thank you so much. Let's start out with a question from Amy, who asks, can you share the asset limits for the programs?
Sure, I have that right here. They do vary. So I can tell you that any of the SNAP assets are not considered. We don't have to worry about verifying assets. For the family care or all kids program, so that would be Family Assist, All Kids Assist, Family Care Assist, Moms and Babies and Family Planning, we don't have to look at assets. However, for the AABD program, which is the Aid to the Blind and Disabled, we do have to look at assets for those individuals. It is $2,000 for one person and $3,000 for two people.
Okay, kind of a follow-up related question here. I would love an explanation of the FPL as it applies to the individual or family's income.
The FPL changes every year. I think currently 100% of the FPL is $1,255 for one person. If you compare that, and for two people, it's 1,703. That's the income, countable income. That's 100%. If you go to the All Kids Assist, which is for children only, it jumps to 318% of the federal poverty level. So for example, a family of four, their countable income can be up to $8,268 per month. And then our Family Care Assist or our Affordable Care Act adults who are 19 through 64, they are at 138% of the federal poverty level. So for one person currently, that is $1,732 per month. And for two people, $2,351 per month.
All right, Sonia, you've got your hand up. Would you like to unmute and pose your question? Sonia, you're muted. Hold on just a second. Sonia, can you unmute yourself or no?
There we go.
There we go.
I am the interim director for the community healthcare clinic in Normal, Illinois. And our patient volume is maybe as much as 88% Hispanic.
Okay.
We do not ask for citizenship. We treat anybody that comes in. We treat the working poor. These are people that make too much money to qualify for Medicaid, but not enough to buy health care.
Mm.
You understand that?
Yes,
And
very
so
much.
there, because of one of our funders, we have a limit of 128% of the federal poverty level that people can make. And right now, that's lower than the minimum wage in Illinois.
Mhm.
So I guess I'm coming back to you to say, what can we tap into for on behalf of these patients from some of these benefits? And maybe this is something that we need to talk to just privately,
Sure.
if that would work better.
Sure. I mean, I know if you're serving children,
We're not. We're
no,
serving adults.
adults only.
Children have coverage. They're
Yes.
covered.
Yes.
So
Yeah.
we just focus on adults.
Right.
And it's really the working adults mostly.
Yep. The federal marketplace, have they ever applied on the federal marketplace?
I don't know that.
Okay, that is typically where we refer people, the federal marketplace to apply for health insurance. There are plans that are based on income. Of course, they're not free. They would have to pay. But they are based upon their income. So hopefully they'd be able to find something that they can afford and that would be some decent coverage for them.
Yeah. So somebody that reaches that point,
Yeah.
sometimes they end up taking two jobs because they desperately need it. And when they do, then suddenly they don't qualify for here. So you're saying we could refer them to something called the federal marketplace?
Yes.
To look for coverage that is affordable for them.
Yes. Correct.
Okay.
Mm-hmm.
Any other advice?
Oh, it's a tough one. Adults are tough. I can't think of anything else basically because you are a community clinic, right? Are you are you rural health or anything like that type of a clinic?
We are simply funded by donations from people in the community.
Okay. Okay.
That's
Gotcha.
totally. We don't get federal assistance.
Yeah.
We are part of the Illinois Association of Free and Charitable Clinics.
Okay.
And so
I know some areas have what they call free clinics. Some of those are through hospitals. So we would probably, search in the community. We might be able to find a free clinic that they could access. I think I'm pretty sure there's an income guideline there, but I know the biggest thing is that they cannot have health insurance and be able to go there.
yeah.
But I don't know, in your
don't have.
community. Yeah.
Okay. I'm taking a lot of your time, Diane.
No,
I may
it's
want to
okay.
talk with you later on.
Sure. Absolutely.
Is there a good phone number that you would like for me to call you?
Sure. Let's see. Let's do 217
Mm-hmm.
223
Mm-hmm.
0421.
Got it. Thank you.
You're welcome.
And Sonia, for your reference, the Illinois Marketplace, the state of Illinois has a landing page on the web. It's getcovered.illinois.gov.
Okay.
Go.
Get covered, Illinois.
Getcovered.illinois.gov.
Illinois.
Yep.
Got it.
Have a question, an interesting one from Carol. I understand that there are instances of skimmers stealing SNAP benefits. Can you discuss the app that allows people to lock their accounts?
Yes, they can go directly to the EBT, capital EBT edge, EDG.com. They can go right on there and they can freeze their card in between them using it. They can they can make sure that no out of state purchases are made. There's several different options on EBT Edge. And we strongly recommend that to our clients to make sure that they do that, not only for our clients, but for everyone to know. There is some mechanism that these skimmers and scammers are putting over the point of service machines where we put our credit card in, where we swipe. And I saw a presentation with a video of how quickly and how sly someone is to put that right over top, and you cannot tell the difference. You can't tell that, there's something that's covering it. And that's how they steal information. So it's, I think, important for everyone to know that exists and that's out there. And we've had a lot of our clients get their benefits stolen. We have been able to replace our SNAP benefits, but not our cash benefits at this time for our customers.
Okay, so always exercise some caution. Would you mind repeating that email one more, or that web address one more
Yes,
time? We'll put it into the chat.
sure. It is. I want to make sure that I give you the whole thing. If you'll hang on one second, let me stop sharing this real quick. And I will get that for you. Oh, I'm having trouble. Okay, sorry. It's moving slow. I just want to make sure that I get the whole thing for you. Okay, let me see here. It's actually a contractor that we contract with. And I want to make sure I get their website correct. I'm pretty sure it's ebt.edge. I'm so sorry. It is not coming up. I don't know. I'll send that to you, Mike, so that you can, so that we can reach back out to let everybody know what that is. It's not
Terrific.
giving me the website.
That's fine. When you get that located, send it to us and we will drop
Yep.
it into the communication that we send out,
Great.
along with the slides from today's presentation and the link to the recording.
Great. I think I just found it. So sorry. It is E as in Edward, B as in boy, T as in Tom, E, D as in Donald, GE.com.
ebtedge.com.
Yes. I
Okay,
knew I'd get it. Right.
thank you.
You bet.
Does anyone else have any more questions that they'd like to pose to Diane while you've got her right here, literally at your fingertips?
I'll just unmute and ask a question. I am wondering, we have this series that has like the overall theme of with the aging population in Illinois, more and more communities are having a higher proportion of 65 and older. And I just thought maybe I could ask you, what barriers you might see that exist that you could give some advice to the folks on the line about in terms of that segment of sort of the clientele for these services, and if you see any sort of recurring barriers or themes with serving our aging population.
Yeah. Historically, income guidelines, and as we talked about, there's an asset limit for our aged 65 or older disabled and blind population. Most of our seniors are on spend downs, which means they are expected out of pocket every month before they would get coverage by Medicaid. Of course, the majority of them have Medicare primary. And so that has always been difficult for us to be able to help them. You know, if they've got a very large medical bill, then yes, we will be able to help them, but they're still going to have their spend down that they have to pay out of pocket. The federal poverty level is 100%. And, you know, as we just talked about, that's not very much. If your income is at that or above that, I should say, they're going to be put on a spend down. And it's basically the difference between what their income is and what the income guideline is. So if the income guideline is $1,200 a month and their income is $2,200 a month, they're going to be responsible for $1,000 per month of their medical bills, which is insane. So very difficult. I don't know what the answer is. Once again, we try to make referrals. You know, sometimes they don't qualify for any food stamp benefit or SNAP benefits due to their income or very little. So we try to refer them to the senior center, Meals on Wheels, food pantries, whatever the community has as referrals. But it is a very tough population to be able to serve.
Thank you for describing that nuance. I had not thought about that. And if I were, you know, not even sort of in that group of individuals, but related to or just friends, you know, or even just concerned citizen, you know, what kinds of advice would I be inclined to give them? I know you don't feel like you're in the position to give specific advice, but if, you know, maybe you could say if you found yourself in that situation, or if I found a loved one in that situation, what could I do for them, and what could community do for them, and what maybe could they consider as a way to work around that barrier?
Sure. You know, affordable housing for our seniors is huge. You know, there's veterans homes throughout the state of Illinois. If they're a veteran or they're a spouse of a veteran, and there's domiciliaries, there's skilled nursing, there's different levels of that type of housing. I believe they get all of their medical and their prescriptions and everything through the VA at that point. Of course, if they're a veteran, they can access VA benefits anyway if they're going to live in the community. Like I said, just whatever is available in the community is helpful. There just really isn't a whole lot out there for seniors. You know, there is senior housing, but in your smaller rural areas, not much of that. It's difficult. Family members, if they can help, you know, that anything that we can do, I'd always encourage them to apply for assistance, especially if they have any medical bills that they've paid or any outstanding medical bills. Have them apply for medical assistance with DHS.
Well, thank you. And I know we have another question here that speaks to just double checking on that asset limit for folks for Medicaid. Yeah, I don't know if you see that question
Yeah.
there.
The single adults, yes, there is no asset limit for the ACA.
Okay, that's good to know.
Yeah.
All right. Well, and now we've put up a quick poll. If you would mind taking a moment to answer that, this helps us evaluate our programs on an ongoing basis, and we'd appreciate it if you'd take just a moment to answer that question. And in the time that we have left, we still have time to entertain any other questions you might have. Diane, I actually have one that I'd like to pose, and forgive me if you had mentioned it earlier and I missed it. Is there a minimum period of residence in the state of Illinois for someone to receive the benefits here?
Nope. Nope, as long as they have an Illinois address, and there is no minimum. And one other thing, sometimes customers ask, oh, can I transfer my case from Missouri to Illinois or from any other state to Illinois? And the answer is no. We cannot transfer between states. However, if they move within the state of Illinois, we can transfer their case to the county in which they reside. So not out of state, but within state, yes.
Does that transfer happen frequently as a means of allocating resources properly? Is that
You know, it varies. I mean, a lot of times we might see someone from upstate move downstate just because there's no affordable housing, or they have a family member in a different community and they want to be closer to that family member. Their benefits don't change. They don't get any extra benefits. They just continue with their active case, receiving the benefits every month that they've been getting, all based, of course, on their income.
so there isn't any benefit there's no real way to game the system by moving within the state.
Right. And really, there's no gain if they're moving from state to state. That is one thing that we always have to verify. If they received, let's say, SNAP benefits in the state of Missouri this month and they come to Illinois, you know, like even today, this is August 29th, they would not be entitled to August benefits in the state of Illinois. So we do have a checks and balance for that as well.
Okay, so no double dipping. So that suggests that a lot of the information systems that you work with are not just Illinois based, but nationwide.
Right. Correct. Mm-hmm.
Very interesting. Does anyone else have any questions or themes they'd like to address with Diane? Well,
So tell me again where we'll get this video or replay of what we just saw.
Well, you will be receiving, if you were registered for today's event, you will receive an email that will include the link, the recording, as well as the slide deck, as well as some of the other web links that we've discussed today. And if you weren't registered, but someone shared this link to today's webinar with you, again, you can drop your email into the chat and we'll make sure that you do get the materials.
Thank you. Sounds good.
So on that note, I do want to say thank you on behalf of the Governor's Rural Affairs Council, Rural Partners, and the University of Illinois Extension to Diane for her presentation. Very informative, very helpful, and I hope the audience found it such. As I mentioned earlier, drop your email into the chat for inclusion, not only in the distribution list for today's materials, but also we'll put you on the mailing list for future presentations. For example, I will note that the next webinar in this health and healthcare series is coming up next week, next Thursday on September 5th, again at 12 p.m. noon. And we're going to review the state's plans for development of a state plan on aging, which addresses the question of how to best support and connect with older Illinoisans and family caregivers through the matrix of the Older Americans Act programs. I'd also want to invite you to visit our website at go.illinois.edu/LGE for access to our video archives of prior presentations on a wide variety of community development topics. We've been building this archive now for a number of years, and there are literally hundreds of presentations available on a wide variety of topics. And I think it's a tremendous resource for community leaders and officials across the state. So please, go.illinois.edu/LGE. And with that, I want to say thank you to all of you for attending today's webinar. Really appreciate your presence. Have a great day, and we hope to see you back for future presentations. Thanks so much.
Thanks, everyone.